Thank you, Mr. Chairman. Dr. Hall, I want to continue on your answer to Senator Van Hollen. You talked about your interest in a level playing field, and so it suggests that there's some values-based decisions that you make with respect to the release of your scores. My fear is that the way in which Congress is interacting with CBO is changing radically. So here is the list of CBO publications related to healthcare legislation that were released in 2009 and 2010, and it is a very long list. CBO started sending out reports in early 2009 and then began releasing estimates of the committee products once committees began their work, so that by the fall of 2009, there were complete CBO reports that members could look at as the basis for considering legislation on the floor. What's happening here is very different. Republicans are not going through the committee process. There is no bill being produced by committee. They are negotiating the product in secret and then having confidential conversations with CBO. So to the extent that you are interested, and these are your words, in a level playing field, what do you do about the fact that this relationship of confidentiality can be taken advantage of to effectively hold the CBO score until the last possible minute, giving members of the minority party a very small amount of time to look at that legislation? This policy of waiting to release it until it was made public made a lot more sense back when committees functioned and you had a CBO score on the committee bill. Does your view of maintaining a level playing field change given the fact that you may no longer ever do a committee-based score on a major piece of legislation?
Well, we work confidentially basically because Congress finds it valuable for us to work confidentially. They can give us informal estimates and get some idea of what we think about them. I think it helps, probably helps make better products. It's done all the time on a lot of different pieces of legislation. But I understand the issue that during this time period it is kept confidential, and we do that because we're asked to. And I think it's sort of above my pay grade to recommend a change in that. I do think it would probably change the nature of a lot of the work. The healthcare stuff is one particular case, but we do this on a lot of different things. And we do the confidential work for the minority side as well from committees. So one would have to sort of think about that. But we do our best when like I say, when legislation becomes public, that we will no longer do the confidential work, and any work we do on that piece of legislation will be public. That's sort of I think it's sort of certainly the best that we can do in striking a balance.
Yeah, I don't think we can ask you to make that change in policy unilaterally. I'd raise it in the context of this hearing because I just think that you're being used by the Republican majority for political purposes, and I think it compromises your independence, and it will encourage Democrats, when they're in the majority, to similarly use that confidentiality to hold the CBO score until the last minute. That is at the basis of my worry about the way in which Republicans are acting today. Let me ask you a question about your House score. In the House, opponents of the Affordable Care Act have a favorite phrase, death spiral. They say that the Affordable Care Act is in a death spiral and that we have to rescue it from this death spiral. And I don't read your summary of the House health care bill as predicting that. You score out what would happen to the number of people without insurance in this country over a 10-year period of time with the House health care bill and without it. Without it, you come to the conclusion that at the end of a 10-year period of time, there will be 28 million people without insurance, which is a slightly higher number than today. But with the House Health Care Bill, 51 million people will be without insurance. I don't want to ask you about the 51 number. I want to ask you about the 28. What assumptions are you making about the future of the implementation of the Affordable Health Care Act to come to the conclusion that, by and large, the number of people with insurance will be stable over a 10-year period of time? Are you assuming that the administration is going to actively implement that, that act, and has the conduct of the administration over the course of the first 4 months of 2017 changed your opinion as to what the number of people with insurance will look like at the end of that 10-year period of time?
Yeah, we haven't changed our view on implementation, and we hesitate to do that unless there's sort of specific actions that will likely impact implementation of anything that we can see, and then we'll take that into account in our baseline. So as you say, our view of the Affordable Care Act, we assume that a certain level of implementation going forward. One of the more difficult parts about that, of course, is the Medicaid side of things. And here we're predicting what state governments are going to do. And so a big part of the ACA going forward and the ACA would involve how many states decide to expand Medicaid or not going forward. So that's not really an issue of less an issue, I guess, of implementation by administration, more of how we're projecting that states will behave going forward. And that's a difficult thing. But that's a big part of the uncertainty, I think, for us going forward in this number.
Just one question for you, Mr. Dodaro. What happens to you in a flat-funded budget? Are you able to maintain your existing staff levels in a flat-funded budget?
No, there's no way we'll be able to do that. In a flat funding scenario, we'd probably lose about 200 people by the end of the year, and we would probably be in a situation where we would only have enough people on board. We'd be probably at our lowest staffing level since the 1930s, if that happened, because we've been hovering around there since the sequestration occurred during that period of time, because we lost 15% of our staff during sequestration. And we've, thanks to this committee, for the last few years, we've clawed back some of that and be able to rebuild a percentage of that. So any flat funding scenario would just send us back down to that scenario. It would affect our ability to provide service to the Congress. And would have pretty dramatic effects.
Who do you lose? Who are those 200 that you
well,
lose?
they'd be people who, that's about what our attrition is every year. Yeah. So that'd be normal attrition with zero replacement.
Right.
I've often likened this to being a college football coach where the seniors, leave and there are no freshmen or sophomores coming in, and you just tell the juniors to work harder, and so it's a problem. It would have very serious negative consequences on us to be in a flat funding scenario, and it would ill serve the Congress.
All right. Thank you. Thank you, Mr. Chairman.